Common variable immunodeficiency. It's an immunodeficiency disorder Look at this picture, shows that immune system and symptoms. Introduction. Common variable immunodeficiency CVID is a primary immunodeficiency disorder characterized by low levels of serum immunoglobulins and increased susceptibility to infections. This is heterogeneous condition with wide range of clinical presentations and is one of the most frequently diagnosed primarily immunodeficiencies. Definition. CVID is defined by low levels of immunoglobulin in the blood, leading to increased vulnerability to infections. It is typically diagnosed in adulthood, though symptoms can appear at any age. Types. CVID can be classified into several subtypes based on clinical features, genetic background, and immunologic profiles. Type 1 predominantly affects B cells, differentiation and antibody production. Type 2 involves both B cell and T cell defects, leading to more severe immunodysfunction. 3. Familial CVID occur within families, indicating a genetic predisposition. Causes. Exact cause of CVID is often unknown, but it is believed to result from a combination of genetic mutations and environmental factors. Several genetic mutations have been associated with CVID, affecting various components of the immune system. Risk factors. 1. Genetics. Family history of immunodeficiency disorders. 2. Age. Typically diagnosed in young adults but can present at any age. 3. Gender. Slightly more common in males. 4. Autoimmune diseases. Individuals with autoimmune conditions may have an increased risk. Complications. 1. Infections, recurrent respiratory and gastrointestinal infections. 2. Autoimmune disorders, increased risk of autoimmune diseases such as autoimmune hemolytic anemia, rheumatoid arthritis, and inflammatory bowel disease. 3. lymphoma, and other cancers, elevated risk of developing certain cancers, particularly lymphomas, or chronic lung disease due to repeated infections and inflammation. Pathophysiology. CVID is characterized by empire B cell differentiation and effective antibody production. This results in low levels of immunoglobulins, which are critical for fighting infections. The underlying mechanisms may include genetic mutations affecting immune cell function and signaling pathways. Signs and symptoms. First sign, recurrent infections, particularly of the sinus, lungs, and gastrointestinal tract, to chronic diarrhea, often due to infections or autoimmune conditions. 3. Fatigue, persistent tiredness and low energy levels, or enlarged lymph nodes or spleen due to chronic immunoactivation. 5. Autoimmune manifestation, symptoms related to autoimmune disease such as joint pain and rashes. Medical diagnosis. 1. Blood test. Measurement of immunoglobulin levels. 2. Vaccines response test, assessing the ability to produce antibodies in response to vaccines. 3. Genetic test, identifying mutations associated with CVID. Or flow cystometry, elevating B cell and T cell populations. Nursing diagnosis. 1. Risk for infection related to immunodeficiency. 2. Fatigue related to chronic illness. 3. Risk for impaired skin integrity related to frequent infections, or anxiety related to chronic health condition and risk of complications. Disease management. 1. Immunoglobulin replacement therapy IRT, regular infections of immunoglobulins to boost the immune system. 2. Antibodies, prophylactic or therapeutic use to treat, prevent infections. 3. Vaccinations, non-live vaccines to protect against certain infections, or monitoring and training autoimmune disease. Immunosuppressive drugs may be needed. Treatment. 1. Immunoglobulin replacement, mainstay treatment to prevent infections. 2. Antibiotic prophylaxis to prevent recurrent bacterial infections. 3. Immunosuppressive therapy for managing autoimmune complications. or stem cell transplantation, considered in severe cases. Psychosocial medicine on counseling and support groups to help patients cope with chronic illness and associated stress. To education, providing information about the condition and management strategies. 3. Mental health support, addressing anxiety, depression and other psychological impacts. Prevention. There is no known prevention for CVID, but early diagnosis and treatment can prevent complications. Genetic counseling may be beneficial for families with a history of immunodeficiency disorders. Conclusion. CVID is a complex and variable immunodeficiency disorder requiring comprehensive management to prevent infections and complications. With appropriate treatment, including immunoglobulin replacement therapy and proactive infection control, individuals with CVID can lead healthier lives. Ongoing research aims to better understand and genetic and molecular basis of CVID, which may lead to improved therapies and outcomes. Thank you. Have a nice day.